Hi, welcome to the second part of a three-part series talking about the failed second stage of labor. That means you got to 10 centimeters of cervical dilation, but for one reason or another, your obstetrician had to help you safely deliver this baby. And so if you haven't already, watch part one that kind of talks about the definitions and the chance of you getting stuck in the second stage of labor. And here we're going to talk about some of the misconceptions and some of the important things to understand when you're making the best decision for you and your baby if you happen to find yourself in this situation. So the take-home points. Number one, all operative vaginal deliveries have their risks and their benefits. Number two, every clinical situation is unique. It cannot be stressed enough that it is unique. It is very imperative to pick the best delivery method for each situation. So if you're asking, well, what's the best thing to do if I get stuck? Well, it depends on what's going on. And so you can't just say a C-section is the best thing to do, forceps is the best thing to do, or vacuum assisted vaginal delivery is the best thing to do. And that's what makes this so complicated. So that's why I'm trying to give you a little bit of information to develop a foundation of knowledge that then you can go and have a educated conversation with your obstetrician about what to do when you do find yourself in this situation. So the best way to summarize the situation when you find yourself stuck in the second stage of labor is really buried in the title of this research article, choosing between bad, worse, and worst. So again, there's no good option. You're really just choosing the lesser of three evils. And that makes it very difficult. It's not what you want to hear, but that's why you are preparing for this. That's why you're watching this video. And that's why I made this video. So let's talk about some common misconceptions so that we can dispel any of those so that you can make the best decision going forward. Probably the most common misconception is that if you choose to get a C-section, it's going to be low risk and no problems. I mean, that's what you hope for, but that's not necessarily the right frame of mind. And the reason I say that is this is a study that compared the C-sections in the first stage of labor versus C-sections in the second stage of labor. And it just kind of proves what everybody intuitively knows, that if you get a C-section in the second stage of labor, it's much, much, much higher risk. And we'll get into the actual numbers. But you don't want to go in and say, well, I want a C-section because my friend Susie had a C-section. It was scheduled. The baby was breech and she went in, went out, no problems. Recovery was easy. She went home in 3 to 4 days. That's not the kind of C-section you're going to have. You may have the same outcome where it's easy breezy and your recovery is relatively smooth and unhindered. But you just have to understand that you're at a much higher risk getting a C-section in the second stage of labor than getting a C-section in the first stage of labor. So this study, again, combined a bunch of studies and looked at the outcomes of C-section in the first stage of labor versus in the second stage of labor. And as you can see here, the outcomes include maternal death, ICU admission rates, blood transfusion rates, injury to the bladder, hemorrhage rates, infection rates or fever rates, second surgeries, and they're all higher. They're all much, much, much higher. So if you look at maternal deaths, for example, again, it's a very rare complication, albeit, but in this meta-analysis, it was almost 8 times higher chance that you would have a maternal death if you had a C-section in the second stage versus the first stage. Again, that's a relative risk. And I think we can all agree that the relative risk ought to approximate the odds ratio because the incidence of maternal deaths is so low. But I'm not trying to scare you. I'm just trying to illustrate the point that C-sections in the second stage of labor are much riskier for moms. But it's not just for moms. It's actually riskier for babies as well. If you look at these outcomes, all of these outcomes, neonatal deaths, intubation, fetal injury, neonatal seizures, those are all more common in the second stage versus first stage C-sections. So not only is it a higher risk for moms, it's a higher risk for babies. And that's why you need to factor that in when you're deciding if you want to proceed with a C-section or an attempted operative vaginal delivery, which is either forceps or vacuum device assisted vaginal deliveries. The second misconception, not really a misconception, but I just wanted to address this mentality that some patients want to compare a complicated vaginal delivery to an uncomplicated C-section, or a uncomplicated vaginal delivery to a complicated C-section. You simply cannot compare complicated deliveries to uncomplicated deliveries. Obviously, the uncomplicated delivery is going to have a better outcome. So you need to make this decision more objectively. You can't just assume one method is going to have a higher complication rate than the other. So try not to assume that something's going to go wrong during a vaginal delivery and that's why you chose a C-section. Or don't do the opposite. Don't assume something bad is going to happen in the C-section and try for the vaginal delivery. You just have to make a more objective choice and come at it from a more objective mentality. Because if you look at the data, obviously, if you have an uncomplicated vaginal delivery or an uncomplicated forceps assisted delivery or an uncomplicated vaginal delivery, you're going to have a better outcome than an uncomplicated C-section. There's a million studies to show that. And that's the whole reason we're even trying to deliver patients vaginally. If it was proven that C-sections were better for moms and babies, well, we wouldn't let anybody labor. We would just deliver everybody by C-section. But the truth is that a C-section, even an uncomplicated C-section, is going to have more complications than a uncomplicated vaginal delivery, right? So that can include problems in the immediate postpartum period, where you have more postpartum depression after C-sections, you have harder time breastfeeding after C-sections, and then it can cause more problems getting pregnant. If you've had a C-section, you have a higher chance of miscarriages and abortions. You have a higher chance of ectopic pregnancies. You can also have complications during your next pregnancy. You can actually have complications such as abnormal placentation. That includes placenta accreta or placenta previa. You can have complications during the next delivery if you're trying to deliver vaginally. You are at a higher risk for uterine rupture, where the previous C-section scar opens up. You can have higher risk C-sections if you've had a previous C-section. You're going to have more scar tissue. It's going to have higher chance of injury to adjacent organs and tissues. You're going to have a higher chance of injuring the baby or delays in delivering the baby. And then if you look at second stage C-sections in particular, that actually will have a higher risk of preterm delivery in your next pregnancy. So these are all things you have to consider, because that's why we are trying to deliver these babies vaginally. Uncomplicated, of course, versus uncomplicated C-sections. So that's where the judgment comes in, that if you think that this vaginal delivery is going to work with the help of kiwis or forceps, that's fine. But if you think it's high risk or it's not going to work for this reason, that reason, or the other, well, you should go for the C-section and not set yourself up for failure. So the other and final misconception that people have is, we touched about it earlier, that there's not one method that is better than the other two. It's like comparing a hammer to a screwdriver to a saw. These are three different tools for three different situations. You can't say that one is better than the other two. That's simply an erroneous way to think about it. You really have to think about the individual situation at hand and pick the best method for that situation. And that's why it's very important to have a conversation with your obstetrician to see what they think, what their recommendations are. And if you have this conversation before you're even in labor, well, that's when you can find out if your doctor wants to do C-sections in these situations, because some doctors don't even use vacuums and some doctors don't even use forceps, or they don't do both. And that's actually fairly common. You're going to find that a lot of doctors just simply are not going to offer a vacuum-assisted vaginal delivery or forceps-assisted vaginal delivery. And if you find yourself stuck in the second stage of labor, you're going to get a C-section. And that's fairly common across the country. That's why the cesarean section rate is 30 to 40% in a lot of places because they just aren't being offered operative vaginal delivery. So it's important for you to find that out ahead of time. You don't want to find yourself stuck in the second stage of labor and then finding these things out and then finding that your options to deliver your baby are very limited. So make sure your desires are in alignment with your obstetrician. This is just kind of illustrating the point. There's several different factors that we can't get into that help dictate what the best mode of delivery is, how to best and safely help patients deliver their baby when they're stuck in the second stage of labor. So again, the take-home points. Number one, all operative vaginal deliveries, C-sections, vacuums, and forceps, they all have their risks and they all have their benefits. Number two, every clinical situation is unique. It is imperative to pick the best delivery method for that situation. And that's going to rely heavily on the comfort zone of your obstetrician. So never push your obstetrician out of their comfort zone, but you do need to have an intelligent conversation with your obstetrician so that you can make the best decision for you and your baby if you find yourself stuck in this situation. So that concludes part two. That got into the details a little bit. It can get very dense, very heavy, very fast. Part three is going to be absolutely crazy. A lot of doctors won't even understand some of the intricacies of part three, but I made the part three just to kind of wrap it all up. Otherwise, you just kind of get left dangling. So if you want to stay tuned for part three, and like I said, you already have a foundation from parts 1 and 2 to help guide your decision-making process if you do find yourself stuck in the second stage of labor. So thank you for watching. Stay healthy and stay educated. Thank you for watching this episode of Patient Education for the Educated Patient. I hope you found this content both helpful and meaningful, and that you'll be able to use it to live a healthier life. If there's any questions, please leave them in the comments section below. I do welcome feedback, so please also leave me any comments or suggestions in the comments section. Please subscribe and turn on the notifications, and I hope to see you at the next episode. Until then, stay healthy and stay educated.